Hi, my name is Miss Cotten, and I'm going to perform the basic facial with steam. I prepared the table for the products that we're going to need. And to your left, we're beginning with towels, a rubber mixing bowl, gloves, a bowl for water. Here are the disinfectant wipes, our to be disinfected container, the disinfectant spray. We also have tissues. This is a set of comedone extractors. We have the brushes for the mask. We have our dispensers and our products here, which include the cleanser, the exfoliant, the mask, massage oil, eye cream, moisturizer SPF. We also have cotton rounds, 2x2s, 4x4s, disposable sponges, and they're all set on this tray. Because we have not used them yet, they're considered to be sanitized, so I must cover that and keep it covered until it's time to use. Equipment: facial bed and stool, facial steamer, magnifying lamp, hot towel cabinet. Now I'm going to prepare the room. The first thing I'm going to do is disinfect my workstation by using a disinfectant wipe. I have my gloves on before I remove the wipe. Disinfect the workstation. Allow that to sit for 2 to 4 minutes to dry, and remove another wipe. And repeat the process. Allow that to dry for 2 to 4 minutes. And now it's disinfected. I have gathered all of my supplies, and they're dispensed properly in their dispensing containers, and they're labeled. And now here is the bed that needs to be draped a certain way. And we're going to drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. We're going to place 1 towel horizontally at the head of the bed. And at this point, we would lay a headband or hairnet across the first towel with a roll towel to support the client's head and neck. The third towel we're going to lay across the client's décolleté. And of course, the top sheet would be folded down to the center until the client is laid on the bed. Client consultation. I'm going to greet my client and escort her to my work area. At this time, I'll consult with the patient on medications, products used, allergies, facial surgeries, and any recent facial injections. I'll also determine the client's preferences and assess her needs. I will perform a skin analysis to ensure that there's no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, no open wounds or sores in the areas, no infection or infestation to prevent from safely performing the service. If the client is free from all of the above, I'll proceed with the treatment. I have prepared the client for the service. The client has disrobed appropriately. I did help her onto the bed, swaddled the sheet over her. I placed the third towel over her décolleté, her hairnet or headband over her head, and her ears covered. And I've placed a roll towel under her neck for support. Now she's ready for treatment. Now I've performed the hand washing procedure prior to now. The next step is cleansing the face. I'm going to apply cleansing product to the eyes and the lips. I'm going to use a spatula and a 2x2, and this is my cleanser. So I'm going to remove the cleansing product and apply it to my 2x2. Discard this. Apply it to the client's eyes. Discard this. Now I'm going to get another 2x2 to cleanse the lips. Oops. Discard this. You cleanse the lips by bracing. You're working from the outside corner to the inner lip. 3 passes on both sides. You're going to double brace by wiping down the eye area once we get to the eye area, but just single brace for the lips. 3 passes on both sides, outer to inner. And I'll discard this. You're going to clean the under eye area from outside to inside. Three times without pulling. 3 times down. 3 times inward. Discard. Same with the other eye. Discard. I'm going to apply cleanser to my hands with a disposable spatula. Discard. Rub my hands together. I'm going to apply the cleansing product with both hands, starting at the neck, sweeping from the center of the chin to the jawline, to the corners of the mouth, up the temples, down the corners of the nose, alongside of the nose, to the center of the forehead. I use my ring finger to stroke under the eyes, to the bridge of the nose, out and over the eyelids. To remove cleanser, I'm going to submerge a disposable sponge into a bowl of warm water. Use my disposable sponges. Start at the neck, working upwards, following the contours of the face. Working until all of the cleanser is removed. This I will repeat 2 times. I'm going to discard my sponges. I'm going to sanitize my hands. This is my hand sanitizer. And perform my skin analysis. When performing the skin analysis, we must apply eye pads before turning on the mag lamp. These are the eye pads I will apply to the client's eyes. And during the skin analysis, we're going to check for abrasions, excessive sebum, flakiness, fine lines, wrinkles, freckles. I'm going to remove the eye pads, discard them, and I'm going to apply toner to my 2x2 by misting on the gauze pad, then applying at the neck, working upward to the forehead in sweeping motions. And I'm going to discard my disposable. Now we're going to exfoliate and steam. There are 2 ways that I'm going to show you to apply the exfoliant. One with hands and the other with a fan brush. Applying the exfoliant with my hand, I'm going to dispense a pea-sized exfoliant into my hand with a disposable spatula. I'll dispense it directly into my hand. I'm going to discard my disposable spatula into the trash. Rub my fingers together to evenly distribute the product and massage in the product according to the directions, avoiding the eyes, nose, and mouth. The second way we can apply the exfoliant is with a fan brush. This is the fan brush that we'll use. We're going to dispense a pea-sized product onto a palette. I'm just going to pour it on. Discard. Take my fan brush, saturate it with the exfoliant, throw this away, and apply. At this point, we would steam. We'll turn our steamer on, position it away from the client as the steamer warms up and it emits mist. Once the mist is emitted, we'll position the steamer 16 inches away from the client, aimed at the client's chin, for even distribution, and we'll steam for 3 to 5 minutes. Now we'll remove the exfoliant, and to remove the exfoliant, we're going to submerge our sponges in warm water, squeeze out the excess. We work upwards from the throat to the face until all of the product is removed. If you prefer to use a steam towel to remove the exfoliant, you unroll, test the temperature, place it across the chin, upward to the forehead, nostrils uncovered, wipe downward from the forehead, and remove all product. I'm going to demonstrate 2 forms of extractions. One is the cotton swab method, using 2 professional size cotton swabs soaked in astringent. With gloved hands, gently apply pressure on either side of the impaction. Roll around the impaction, back and forth, until the impaction is released. Repeat this process with new swabs. I'm going to discard these swabs. And apply toner. The second method is the finger cotton method. I'm going to wrap my gloved fingers in tissue or cotton that is pre-soaked in astringent. I'm going to gently apply downward pressure on either side of the impaction at the base. Gently roll around the impaction, back and forth, until the impaction is released. Repeat the process with new tissue or cotton. Discard. And apply toner. Dispose of all contaminated disposables in your waste receptacle. Remove your gloves. And sanitize your hands. Now we're going to perform the massage. First, we're going to apply a dime-sized amount of massage product to your hands. Apply product to the décolleté and neck using long, gentle strokes. Apply product to the chin, to the forehead in the same manner. Use caution around the eyes and avoid stretching the skin. Begin at the forehead using an effleurage hand-over-hand movement, left to right, then right to left. Repeat this 3 times. Using the middle fingers of both hands, slide in continuous half-circle movements over and under while moving across the forehead, right to left, then left to right. Repeat this 3 times. Apply slight pressure to the temporal muscle before continuing. Use tapping motion around the eyes, the brow bone, the zygomatic arch, and upper cheekbones. Repeat this 3 times. Perform small circular movements around the temple pressure points and pause with slight pressure. Repeat this 3 times. Massage the outer base of the nose with small circular movements up the sides, over the eyebrows, and back to the base of the nose. Repeat this 3 times. Using the index and middle fingers in a V pattern, perform scissor movements up to the hairline. Repeat this 3 times. Slightly lift upwards 3 times at the corners of the mouth. Again, repeat this 3 times. With your thumb and forefinger, use slight pinching motion from the jawline to the earlobe. Repeat 3 times. Massage the neck, chest, and shoulders using small circular motions. Use the effleurage hand-over-hand movement to both sides of the face, forehead, and chin to complete the massage. Pause at the temples and release. To remove the massage product, submerge a disposable sponge into a bowl of warm water and squeeze out the excess. Starting at the neck, work upwards, following the contours of the face until all of the massage product is removed. Now it's time to apply the mask. Obtain mask with a disposable spatula and place on a palette or bowl. This is my mask. This is my palette. I'm going to discard. Apply the mask on the client's face using your hands, a spatula, or a fan brush, starting at the neck. I'm going to use my hands. Discard my palette. Starting at the neck, working upwards, using long strokes, ending at the forehead. Do not get products into eyes, nose, or mouth. Allow the mask to sit 5 to 10 minutes or according to manufacturer's directions. To remove the mask, we're going to submerge a disposable sponge into a bowl of warm water, squeezing out the excess. We're going to start at the neck and work upwards, following the contours of the face until all the product is removed. Mist a disposable gauze with toner and apply to the neck, working upwards towards the forehead using sweeping motions. Now we will apply the eye cream. We're going to remove a pea-sized amount of eye product using a disposable spatula and apply it to the hands. Apply the product using small tapping motions around the zygomatic arch and brow bone. Next, we will apply our moisturizer and SPF. We'll remove a dime size of moisturizing product and SPF, it's mixed together, onto a disposable spatula. Apply it to the hands. Apply the product to the client's entire face, working from the jawline to the forehead. Blot excess product with a tissue. This concludes the facial service. Now we're going to discuss aftercare. Once aftercare is discussed, I'm going to escort my client to the front and give her any information she needs. Now that the service is complete, I've applied my gloves. I'm going to discard all of my single-use items, place the items to be disinfected in my items to be disinfected container. I'm going to clean and disinfect my work area, remove my gloves, and perform the hand washing procedure. This concludes the basic facial with steam.